The body is made up of different types of cells which grow and divide to produce more cells when necessary. Cancer is a group of related diseases that arise from cells becoming abnormal and dividing uncontrollably to form more cells, creating a mass of excess tissue called a tumor. Tumors can be malignant, which means cancerous, or benign, which is not cancerous. Lung cancer is the chief cause of cancer deaths for both men and women. It is also the most preventable type of cancer. Smoking tobacco or being exposed to secondhand smoke is responsible for approximately 90% of lung cancers. Skin cancer is the abnormal proliferation of skin cells. The two major groups are melanoma and non-melanoma. Most non-melanoma cancers are highly curable. Melanoma is highly curable in its early stages, but it is highly invasive and has a poor prognosis if diagnosed in later stages.
Not all types of skin cancer can be prevented, but some ways to reduce your risk are limiting your exposure to the sun by covering your skin, wearing a hat and sunglasses, and putting on sunscreen before going outside. Avoiding other sources of ultraviolet light, such as tanning beds and sun lamps. Avoiding exposure to harmful chemicals. For early diagnosis, check your skin regularly and inform your doctor if you have any of the following: new growths, spots, bumps, patches, or sores that don't heal after 2 to 3 months. Growing lumps with a rough, scaly, or crusted surface. Flat reddish patches. Spots that are A, asymmetric, B, have irregular borders, C, have irregular color, and D, larger than 6 millimeters in diameter, which is about the size of a pencil eraser.
Breast cancer is the second most common type of cancer among women. A woman's risk of developing breast cancer over her lifetime is 12%.
Risk factors for breast cancer in women include older age, your first period at an early age, older age at first birth or never having given birth, a personal history of breast cancer or non-cancer breast disease, a mother or sister with breast cancer, dense breast tissue indicated by a mammogram, taking hormones such as estrogen and progesterone, drinking alcohol.
Two important means of detection of breast tumors are mammograms and breast exams by the woman or a healthcare professional. Mammograms are low radiation X-ray films of breast tissue. Not all breast cancers can be detected by those means, but monthly self-exams starting early in life and yearly mammograms after the age of 40 greatly increase the chances of early detection and successful treatment of breast cancer in women. Colon cancer is a cancer of the colon or large intestine. Most cases of colon cancer begin as small, benign clumps of cells called adenomatous polyps. Over time, some of these polyps become colon cancers.
Okay. Risk factors of colon cancer include male gender, age greater than 50, a personal or family history of colorectal cancer or polyps, inflammatory intestinal conditions, low fiber, high fat diet, diabetes, and an unhealthy lifestyle.
Prostate cancer is the cancer that occurs in a man's prostate, which is a small gland that helps produce semen. It is one of the most common types of cancer in men. Factors that can increase your risk of prostate cancer include being over 65, having a family history of prostate cancer, and being overweight. You can reduce your risk by eating healthy, staying active, and maintaining a healthy body weight. Cervical cancer is a disease in which malignant cells form in the cervix. The cervix is the connection between the uterus and the vagina. Infection of the cervix with human papillomavirus is the most common cause of cervical cancer.
To prevent precancers caused by HPV, delay having sex until you are older, limit the number of sexual partners, use condoms, do not smoke, and get vaccinated.
Since the chance of recovery is better when the cancer is found early, women should have yearly checkups, including a pap smear, to check for abnormal cells in the cervix. A vaccine, Gardasil, is available for women ages 9 to 26 to prevent infection from the most common cancer-causing strains of HPV.